Okay, so hey everybody. Now we're going to talk about using the Philips products with a baby in prone position, which is a position we know that babies like to be in when they're in their isolates. So one of the big things that's a bit of a practice change, or what I'm looking for more consistency with, is when we place babies in prone, that we're giving them some depth off of the mattress. Kids should not be laying just flat on a mattress. It does not promote flexion. It does not promote midline. So when you have your baby on their belly, please be mindful of that and give them some sort of depth from that mattress, whether that be with a prone positioner, with a Z-Flow positioner, or with a surfboard like this. So I've taken a diaper and I've rolled it up to give this baby a surfboard to lay on. That's what we're gonna call it. It's important that it not be too much wider than their from their nipples. Any wider than that, it's not gonna allow for a lot of midline position. So be mindful of that. We're gonna place that right in our Snuggle Up. We're gonna place our baby on it, and when I place a baby on these boards, these surfboards, what I'm looking for is support at the head. I want their arms to be able to round forward, and again, I'm looking for that flexion at the hip. So I'm gonna place this baby. Jane doesn't like to turn her head so much, so we're gonna pretend that she does. Again, using this Snuggle Up, you're getting that baby way down in the pocket so that they have something to push against. That's gonna help encourage that tilt at the hip and flexion at the hip and knee, which is what we want. We're gonna be able to put that baby in a nice position there. I'm gonna take this bendy bumper again, and I'm gonna slide it down to give that baby containment on the sides and containment at the head. They're gonna be able to get into that flexed hands towards face position, which we love. I'm gonna take a posy now, and I'm gonna wrap it around this bendy bumper to pull it away from the baby's face, because I know we get worried about that. So now we won't have to worry about that baby's airway being obstructed. And for your babies that are vented, you're gonna be able to kind of lie it right on that bendy bumper there. So, and I'm gonna give this baby, I'm gonna scooch him down just a little bit so she can get a little bit more containment of the head. Then I'm gonna take those straps like we talked about earlier. If I need to tie them up, which I do for her, I'm gonna do that. And then again, I'm gonna give her some nice input on her back. If you've got a baby that's really disorganized and you feel like they need a little bit more input, using the beanbag is okay. We did not talk about the beanbag so much when the baby was in supine, but my big thing that I'd like to just make sure everyone knows is use these legs to put in the amount of beads that you need to provide containment without putting so much pressure on this baby that they're gonna feel like they can't breathe. We should not be draping these across a baby's body. These weigh a pound. So that's just too much weight for these kids to manage. But a little bit of input along their lower body, or a little bit of input across the top of the head, just so that they can feel nice and contained. You can also take the beads here, put a few beads in both, give them a little input on the head, give them a little input on their butt, and they're nice and contained, and they look nice in midline, which is what we're looking for. So that is how I would suggest you use this product if you're putting a baby in prone.